The aesthetic outcome for both composite bonding and porcelain veneers, if done well, can be really outstanding. Composite bonding and porcelain veneers are two very different treatments used in cosmetic dentistry. If you are considering having either of these treatments done, it's very important that you understand the differences between them before deciding which one is right for you. Essentially, composite bonding is a material that is applied directly to the teeth that looks exactly like tooth structure and doesn't involve any injections or drilling and is done in a single visit usually, whereas porcelain veneers involve some prepping of the teeth to create space for the porcelain, and then scans or impressions are sent to the lab and the veneers are made in a lab by a ceramist and fitted to the teeth on a subsequent visit. So both procedures usually involve quite a lot of pre-planning to decide what changes are going to be made to the teeth, but once it comes to the actual procedure itself, the composite is typically done in one single visit in the dental chair, where the dentist applies the composite resin material directly to the teeth, hand sculpts it and polishes it. Porcelain veneers involve some prepping of the teeth, and then scans or impressions are sent off to the lab where a ceramist will then make the porcelain veneers on models of the teeth, and they'll be subsequently tried in by the dentist, and if approved by the dentist and patient, will be bonded to the teeth on a subsequent visit. For a full smile makeover, the composite bonding will usually take a full morning or an afternoon for a full set of upper or lower teeth. For porcelain veneers, the preparation visit will normally be a full morning or an afternoon, and then the fitting of the veneers will be another morning or an afternoon a couple of weeks later. The aesthetic outcome for both composite bonding and porcelain veneers, if done well, can be really outstanding. But the results for the composite bonding tend to come down to the skill of the dentist in making the composite look exactly like natural teeth. And in the case of the porcelain veneers, it largely comes down to the skill of the ceramist who's making the porcelain mimic natural teeth. Composite resin is a material that we've used in dentistry for many years and has mostly been used for fillings. However, in recent years, because of the advances in both its appearance and its function and hardness, it has been increasingly used for more extensive treatments such as full smile makeovers. Porcelain is, again, a restorative material that's been used for many years for things like crowns in dentistry, and because of its durability and hardness, it makes a really beautiful enamel replacement, and so is that a really perfect material to use for something like porcelain veneers. The main thing to understand in terms of the durability of composite bonding and veneers is that composite is not as hard as enamel, whereas porcelain is harder. This means that over time, the composite bonding will tend to age faster than natural enamel. So through just normal eating, but also through things like clenching and grinding at nighttime, the composite will tend to wear out faster than the enamel, and so will need some touching up or to be replaced after a certain length of time. With porcelain veneers, because porcelain is harder than enamel, it won't actually tend to wear like composite bonding. However, there are other reasons why it may need to be eventually replaced, such as, for example, gum recession with aging, which can lead to unsightly margins, and a decision to replace the porcelain. Composite bonding can be used for anything from really minor chips or adjustments to the appearance of a single tooth or multiple teeth, right up to full makeovers and full transformations. Porcelain veneers, in general, we will reserve for more major changes to either the shape, color, or alignment of a tooth or teeth. The cost of composite bonding will tend to range from about £200 to £500, depending on how much work is needed for each individual tooth. Porcelain veneers are much more expensive than composite bonding because the treatment tends to take about twice as long per tooth, and because there is the additional lab fee. It is extremely important to take very good care both of composite bonding and porcelain veneers to make them last as long as possible. We definitely recommend seeing your dentist and hygienist regularly so that they can monitor the health of the teeth and the composite bonding of veneers over time and make any recommendations to you for their prolonged care. We may recommend wearing a night guard at nighttime to prevent damage from clenching and grinding at night. Good oral hygiene is also essential. We usually recommend a good electric toothbrush and good interdental cleaning with either floss or TP brushes, and a good fluoride toothpaste as well. Both composite bonding and porcelain veneers can be used to make really significant changes or minor ones to the appearance of but there are very important differences that you should bear in mind before making your final decision. Ultimately, your dentist will advise you on what they believe is the best way forward for you, and your decision will also come down to things like cost, lifespan, and overall aesthetic improvements. In many cases, both composite bonding and porcelain veneers will yield really beautiful results for the changes that you're trying to make to the appearance of your teeth. You should make this decision with your dentist, and ultimately it may come down to considerations such as cost and long-term durability.